Hello, the topic which I am going to discuss is fibrinolytics. These are the drugs which are used to lyse or which are used to dissolve the thrombus or clot by activating fibrinolytic system. Fibrinolytic system, how it works? It will be there will be activation of plasminogen to plasmine, enzymatic activation of plasminogen to plasmine, and this plasmine will dissolve the fibrin network. So here in this diagram we could see this tissue plasminogen activators. These are release and there will be activation of plasminogen will get activated into and get converted to plasmine. This plasmine then lies or then dissolves, brings about the breakdown of fibrin, which leads to fibrin degraded products. Along with this, plasmine can also degrade fibrinogen, and fibrinogen degraded products that are being formed. So some agents like streptokinase, urokinase or alteplase, these are what the fibrinolytics, which activates this plasminogen, and there will be a breakdown of the fibrin or breakdown of the clot. Some agents like aminocaproic acid or tannexamic acid, aprotinin, these will inhibit the activation of plasminogen and thereby inhibit the breakdown of fibrin clot or inhibit the breakdown of the thrombus which is been formed. When we compare arterial thrombi with venous thrombi, venous thrombi can easily be degraded or can easily be lysed by these agents, while if we compare with this older thrombi with recent thrombi, then recent thrombus which has been formed, it can be easily degraded as compared to older one. The drugs fibrinolytics which can be which are used are streptokinases, then urokinase, anistreptase, alteplase, reteplase, tenecteplase. These are all plasminogen activators which are administered by IV infusion or by IV injection or by bolus. Previously, these drugs were used for the treatment of deep vein thrombosis as well as pulmonary embolism. But nowadays, it is specifically preferred for acute myocardial infarction. We know how this infarction it occurs. It is nothing but the end product of ischemia. So this ischemia specifically in the coronary artery, this ischemia it leads to myocardial infarction, and ischemia can be because of in the coronary artery blockade will takes place, and this blockade it may be because of deposition of the lipids or maybe because of deposition of thrombus or formation of the thrombus or embolus deposition. So whenever this myocardial infarction, it is because of thrombus formation or embolus deposition. These drugs, these are fibrinolytics, these are useful. It can be useful, these drugs can be useful in peripheral arterial thrombosis or embolism. Then it is to keep the catheters and shunts open or unclotting in the catheters and shunts. These drugs can be used. These agents can be used. Talking about adverse effects, the adverse effect which is associated with this drug are hemorrhage. It may lead to when as this drug is having the mechanism of action, that is activation of plasminogen, and this plasmine then unable to differentiate between the thrombus as well as the fibrin plug which is formed so as to prevent the blood loss. Okay, So what happens is it is not only dissolving the thrombus or embolus which is there into the blood, it also going to affect the fibrin clot which is formed so as to prevent the blood loss from the body, and because of that hemorrhage will be there. Individual drugs, if we talk about streptokinase, it is an protease enzyme which is obtained from beta hemolytic streptococci. So actually it is a protein which is obtained from one of the bacteria, and hence it is antigenic in nature, or it may lead to hypersensitivity reactions like rash can be seen, fever will be there, or it can also lead to hypotension. These streptokinase, it complex with plasminogen, the plasminogen which is incorporated into the clot at the time of clot formation. So streptokinase will complex with the plasminogen and it activates it to plasmin. Because of this, now plasmin, it will responsible for degradation or lysis of the fibrin, and fibrin as well as fibrinogen, and there will be this clot will get dissolved. There will be lysis of the clot. This streptokinase, it can lyse both fibrin as well as fibrinogen, but it was found that comparing to other drug, the specificity towards fibrin of this streptokinase, it is less. Half-life of this streptokinase is around 60 to 80 minutes, and we have seen that it leads to hypersensitivity reactions like rash, fever and hypotension. Next drug, that is anti-strepless. It is an unisolated plasminogen streptokinase activated complex. What does it mean? Anisolated, it means it is acetylated. This plasminogen active site, it is acetylated and preserved. This acetylation, it will block this plasminogen active site, and this complex plasminogen streptokinase activator complex, it is administered into the human being. Plasminogen, it is obtained, it is the pure form which is obtained from human, and streptokinase, it is obtained from the bacteria, and the complex, it is been prepared, and this complex, it is then administered. The complex, it is been made so as to improve the pharmacokinetics, and improved pharmacokinetic as well as site specificity, it leads to better effect and having potent effect. Then this once it will be administered into the body, the acyl group, it hydrolyzes the it hydrolyzes and it get hydrolyzed, and the opening of the active site of plasminogen will be there, and this complex, it will be released and effect will be produced. Alteplase. Earlier this alteplase, it was known as TPA, that is tissue type plasminogen activator, but later on the name alteplase, it is been given, and it is obtained from recombinant DNA technology. It rapidly activates plasminogen and bound to fibrin. Comparing to fibrinogen, when we compare it with fibrinogen, the activity is more towards fibrin, and it is fibrin specific in nature. It is superior to streptokinase and urokinase also, but comparing to streptokinase and urokinase, it is expensive one. The half-life is 5 to 10 minutes, and the side effect or adverse effect profile, it is almost similar as that of streptokinase, except allergic part. It do not show an allergy because it is a recombinant DNA product, DNA technology product, and streptokinase, we know, which is obtained from the bacteria, so it is having that allergenicity, while this alteplase, it is having less allergenicity or no allergenicity. Reteplase, It is also similar to Alteplase, having similar activity. It is also a product which is obtained from recombinant DNA technology, and having similar activity. It will stimulate, or it will activate the plasminogen, and plasmin formation will be increased and clot formation will be there. It is also fibrin specific. The difference is Retaplase, it is having longer half-life, that is of 15 to 20 minutes. Tenecteplase, it is a genetically engineered mutant form of Alteplase, and comparing to others, it is having longest half-life, that is of 2 hours, but as it is the product which is obtained from this genetically engineered Alteplase, it is very expensive. The next drug is urokinase. Urokinase, previously it was isolated from the human urine, but later on, nowadays it is being produced from cultured human kidney cells. It degrades both fibrin as well as fibrinogen, and interestingly it is non-allergic, non-pyrogenic, as well as do not show hypotension, which is the problem with streptokinase. The half-life of urokinase is around 20 minutes. It is comparatively cheaper and can be routinely used, and it is routinely used uh, uh, in the underdeveloped or developing countries. The recombinant form of this urokinase, it is also available in the market. That is recombinant pro-urokinase form of this urokinase. It is recombinant form which is available. So these are various drugs which can be used as fibrinolytics. The topic can be asked for a short note, and we can write all these. We can explain what are fibrinolytics, and also we need to write the details of each and every drug. So here we will come. We are here. The topic it is been completed. We will stop over here and we'll join for the next topic on online mode in next lecture.